Okay, this is the picture for congenital heart disease. We've got right to left, left to right, and also obstructive congenital anomalies. So that's in the center here. We'll go over each one. Let's start over here at the right. Right here we've got tetralogy of Fallot, and tetralogy 1, 2, 3, 4. So there's 4 things, 4 leaves. You've got the right ventricular hypertrophy, VSD, pulmonary stenosis, and an aorta overrides the VSD. So these are 4 different things that happens. You get early cyanosis, and blue babies, will come right away. The heart, it tends to be boot-shaped in radiographs. So if the baby's just born, has cyanosis, VSD, holosystolic, murmur, those are things to look at. So go up here. We got Truncus Arteriosus. It's a failure of the separation of the aorta and the pulmonary artery. Single artery receives blood from both ventricles. You get heart failure, recurrent pulmonary infections, and it always happens with the VSD. So keep that in mind. That's the VSD right there. Over here we got tricuspid atresia. This is a complete occlusion of the tricuspid valve. VSD is also present. So it looks like a lot of VSDs showing up in all of these. Draw a little heart, the septum, and a big hole in it. VSD. Transposition of the great arteries. This is the aorta arises from the right ventricle. The pulmonary artery originates from the left ventricle. Get incompatible with life unless some kind of shunt is present, like a VSD. So that could be. This allows adequate mixing of the blood. It's called by failure of the articopulmonary septum to spiral. Okay, so that comes up at get early cyanosis. It also associated with offspring of diabetic mothers, so that might be something that comes up. And then you've got this really cold Eskimo there. You get cyanosis. So right to left, you get cyanosis. It shows up. Now here we go. Left to right. Did I say right to left? Oh well. Left to right. They all have a D in it. ASD, VSD, AVSD, and PDA. All have a D. Alright, so you've got pulmonary blood flows increased usually, so you don't get the cyanosis. You get increased pulmonary pressure, which can result in pulmonary hypertension. This can cause right ventricular hypertrophy, possible failure. Eventual pulmonary pressure reaches systemic levels, and the shunt is reversed from right to left, and that sends the unoxygenated blood to the systemic circulation. So the late cyanotic congenital heart disease, or Eisenmenger syndrome, is what it's called. So that's the left to right that's changed from right to left. ASD is an abnormal opening of the atrial septum. This is not patent foraminal valve, which does not allow the mixing of blood. So ASD does allow mixing of blood. VSD is most common congenital cardiac anomaly. You get a Swiss cheese septum. There's lots of holes. Patent ductus arteriosus is the aorta and the pulmonary artery have a duct that goes through it. It's got a continuous machinery-like murmur, both diastolic and systolic. It's best heard to the left of the pulmonic area. It's got a soft S3. You've got treatment with indomethacin and sometimes surgical ligation, so that can happen. AVSD is superior and inferior endocardial cushions do not fuse properly, and it's associated with Down syndrome. That's why there's 21 there. You've got obstructive congenital anomalies. You've got the coarctation of the aorta. It's a narrowing of the aorta. It's associated with females with Turner syndrome. There's a 3 sign. It's a notch, so that actually goes with the coarctation, 3 sign. Now, there's 2 types. There are infantile, which is constriction proximal to the PDA, and then the adult, which is constriction distal to PDA. Hypertension in upper extremities and weak pulse in lower, which results in limping, abnormal gait because of the claudication. Murmurs heard through systole associated with red notching. So, pulmonary stenosis and atresia is obstruction of the pulmonary valve. See the stiff bricks, pulmonary stenosis. Right ventricular hypertrophy from that. Aortic stenosis and atresia can be valvular, subvalvular, and supravalvular. Thickening of the ascending aortic wall is associated with Williams syndrome and can hear a systolic murmur and thrill. Isn't it silly, Willie? And systolic murmur. It has to do with Williams syndrome. Silly, systolic, Williams, okay? So these are the congenital heart diseases, and if you can get all of these separated, you know a lot.